Hello, this is my STYDO4 spine practical video. Today the client has come in with a lumbar problem that is also going down the right leg. The pain one is in the lumbar and it has been there for about 2 to 3 years and reports it being as a dull aching pain that is continuous throughout the day. The second pain that goes through the leg started about 6 months ago and it is like sort of a pins and needles sensation. This shows that it could be like a compression on the nerve, of the sciatic nerve, and it causes pain when moving on the right side. The first injury or the first pain started around 2 to 3 years ago. The second pain started occurring around 6 months ago. This client has osteoarthritis in both their knees and on the left side of their hip and is awaiting surgery on their knee but has to lose at least 5 kilograms of weight before that surgery can occur. The aggravating factors that can influence this is getting up from their chair, walking up and downstairs, but mostly walking upstairs, and also movements that like turning that cause more pain. Easing factors are lying down for about 15 minutes at a time and just lying on that left side in particular. And another easing factor is putting a hot water bottle over this area that is affected. Because of this, my conclusion is that the problem is a disc herniation that has occurred in the lumbar spine and is compressing on the nerve that is sending the pain down the right side of the leg, because usually it is unilateral. Sometimes it can be both sides, but in this case it is just down the right side which is causing the pain. Disc herniations usually occur when with aging. This client is 51 years old and aging can cause disc herniation because less fluid is going into the disc, which ends up causing less flexibility and less movement in the disc and makes it more susceptible to trauma. When the client works, they are a postman and they like gardening. These movements are quite physically demanding, and because of this means that the client is more at risk of developing a disc herniation because of their age as well. Common symptoms that are related with a disc herniation is a continuous back pain and the pain that radiates down the right leg, and the excess body weight can cause the disc herniation due to the extra compression. Next we're going to go on to the tests. Right, so the first test we're going to do is a Babinski test. This is a neurological test to make sure that there are no problems with the neurological signs of the patient. If there was to be a problem with the neurological symptoms, then you would have to refer the patient to see a specialist. So what we do for this one, for the Babinski, is you can grab a pen or another object and on the lateral side of the foot, go all the way along the side of the lateral and up along the top of the foot. If you see their toes curl inwards, like toes flex, then it's negative. But if they go up towards them and they extend, then it would be a positive test. To do it again, you'd go from the lateral side all the way along, follow it along, and it would be positive if it flexed. The next test we're going to do is the clonus test. So what you're going to do for this one is you're going to lift up the leg, you're going to put your hand underneath the heel, holding it in a stable position, and what you're going to do is you're going to force the ankle to dorsiflex, and this, if it's positive, the foot will oscillate for a little bit afterwards. So what you're going to do is hold it and force quickly, and then if it was oscillating it would be positive, but it's negative at the moment. Next test we're going to do is myotomes and dermatomes. So if you could roll over me please. With this test, what you're looking for is to try and see if there are any sensory differences on each side. So what we might expect to see is on one side of the leg, they might have sensory problems on one side compared to the other. So what you do is in each section of the leg, you go down and you ask them, you feel it in the same area? Yeah. and you go down, and you're just checking to see that they can feel the same in each part, and making sure there is no sensory deficits. You feel that?
Yeah.
No sensory deficits that can be no sensory deficits that can cause sensory problems. What we're going to do is we're going to get you to turn over again. For this next test, we're going to do a single leg test, and this is to see if there's compression on the nerve. So what we're going to do is going to get you to lift your leg up, please, and we're going to see if they can lift it up as high as they can. It could be a muscle problem, or it could just be a leg problem, a nerve problem. But if it's gets less than 60 degrees and it's painful, then it could be positive, but it could also just be a muscle problem that is causing the impingement. Did that feel alright?
Yeah.
That's fine. Alright, so the next test that we're going to do is we're going to do flexion and extension of the lumbar spine. So if you could stand up for me, please. So to begin with, we're going to do flexion, and so if you could bend forward as far as you can for me, please. And we're going to add a bit of overpressure. Is there any pain?
No.
Usually if there was pain, it would be positive for a lumbar problem. So if you could come back up for me, please. Next, we're going to go into extension, so if you could just lean back as far as you can for me, please. Is there any pain there?
No.
Add a bit of overpressure. Is that alright?
Yep.
Yeah. So stand up. Usually, if there would be pain, then it would be a positive test as well, which could include like facet problems and stuff. So from a differential diagnosis, usually we would do look at other stuff such as spondylosis, spondylolysis, and a facet joint problem. This can occur because spondylolysis occurs when there's like arthritis and is like a degenerative change that is caused by it, and spondylolysis is like when the disc slips out and can also cause compression on the nerve, which could send pain down the right leg and also in the lumbar spine. Right, so we've done the test now, so come to the conclusion that it is probably a disc herniation. But the other possible diagnosis was that it could be spondylosis or a facet joint problem. So what we're going to do is we're going to go around the lumbar spine and we're going to touch and we're going to find where the exact part of the pain is. So would you be able to tell us where it's painful?
Yeah.
Just around there?
Yeah.
So once you find the pain, we're going to apply some mobilisations, known as like PA. And what we're going to do is we're going to get your hand, you're going to grab your fingers, you're going to put your scaphoid on top, and you're going to do oscillations at a certain grade. So grades can be grade 1 to grade 4, with grade 4 being deep and nice little oscillations. You do 2 oscillations per second for 30 seconds, and you can do as many sets as you want. So what you do is you grab your fingers, put your wrist down on where you want to do it, on the treatment where the pain is, and what you do is you push down, stay down there, and oscillate at that area for about 30 seconds. This treatment will help to increase movement, mobilisation of the spine, facet joints, and will just help to improve pain relief, and will help to decompress the nerve, which is causing the pain that is going down the right leg, and also the pain that is around the lumbar spine. You'll also be able to do unilateral PA. So with this one, what you're going to do is you're going to get your thumb, you're going to find the area where it is painful, so the same place as it was last time, and with this one, do the same with the thumb. You're going to push down, find the grade that you want to work at, and do those 2 to 3 oscillations per second for 30 seconds. How's that?
That's right.
this treatment will have the same benefits as the other mobilisation technique. It will help to increase the movement in the spine and will also help to reduce the pain in the areas and should hopefully decompress the nerve and allow the thing to occur. If this still doesn't help, other treatments such as surgery might have to be considered and other medication can be considered. This client had been taking paracetamol before, and if this still doesn't help, surgery would be taken in order to make sure the problem goes away. Other things that can help is with increasing weight loss. So if they lose the weight, it could put less pressure onto the spine and onto the onto the disc herniation, and should help to increase mobility and decrease pain. Another treatment you can do is work in the areas or the movements where it reduces the pain. So for example, if flexion of the spine flexion of the lumbar spine helped to reduce the pain, you'd do this more, as it would help to promote good movement and also reduce the pain. So for this one, if you could stand up for me, or sit on the edge of the bed for me, please. And what you do is you lean forward, please, and flex. And what you do is you get them in this position and you oscillate the movement and help to reduce the pain.